At CVS, we start with our history. Back in 1963, we started as consumer value stores, and we have always put our patients and consumers first. So as we look at solutions to address high drug costs, we look at how we empower our patients and consumers to control that information and make the decisions they need to, in fact, get the lowest cost drug available. So one of the things we've driven over the last several years is something we call real-time benefits. This gives the physician, the pharmacist, and the patient the ability to see what the drug the doctor is prescribing for them will cost them based on where they are in their deductible cycle and based on their plan design. It will also show them up to 5 therapeutic alternatives that are lower cost, so they can make the right choice and the right financial decision to get the medicines that they need to address the condition that they're suffering from. The other thing that we look at is something that's called a preventive drug list. We at CVS have done this for our employees and across a whole host of chronic and complex conditions where generics and brands can be made available. They're made available at a zero copay. And what we have seen is that our adherence rates have gone up significantly as a result of that. When we reduce out-of-pocket costs for consumers, adherence does go up. And then one of the other things we've pioneered is what we call point-of-sale rebates. We started back in 2013 with our own employees. We've seen a 4 to 6% increase in adherence by using point-of-sale rebates to lower the out-of-pocket cost of the counter. And through CVS Caremark, we have now extended that to over 10 million members who are members of CVS Caremark. So there are a number of things that we are doing, again, with the patient at the center, empowering them with their physician, with their pharmacist, to get to the lowest cost drug available. Well, if we look today, healthcare costs are roughly 18% of our gross domestic product. They're projected to run to over 20% in the next several years. That's another $250 billion that will not be available for investment in education, teacher salaries, infrastructure, and other key national priorities. So I think as we look at solutions, again, it comes back to competition. Driving competition where we see costs. Specialty drugs is a key area for this and the use of biosimilars. There are complex generics, though, too, that are difficult to manufacture. There are practices that pharmaceutical companies are doing now using patents to block the ability to bring competition to the marketplace. All of those practices need to be addressed. And ultimately, by empowering consumers and giving consumers and patients the information they need, because we have imposed now an awful lot of responsibility on them because of high deductible health plans to manage their own cost for care. We need to give them the tools and the information to allow them to better manage that. And each of these steps along the way can make a significant impact on how we address this issue going forward. So we've been embarking on a journey over the last several years, whether it's from our decision to stop selling tobacco products, to the leadership role we've taken in addressing the opioid epidemic, to our recent merger with Aetna. And each of these steps is bringing us to the center of healthcare. We view ourselves as a front door to healthcare. We have almost 10,000 locations across this country in communities everywhere. And our ability to interact with consumers, more than 5 million each and every day, to understand what their needs are, to understand where they need to go in managing their care better. That's where we think we can be at the center and drive real solutions. So pharmacy benefit managers have really been put under the spotlight, frankly, by a $200 million campaign orchestrated by pharma to attack the tools that PBMs use to drive real difference, real cost savings for the health plans, for the employers, for the government and state accounts and union accounts that they serve. PBMs drive real value, lower drug costs. The data shows this. We've seen double-digit list price increases, yet our members are seeing frankly, low single digits to even 0.2% in 2017 cost increases because of the tools that PBMs do. And that drives real savings not only for the plan sponsor, which is the employer, the health plan, the state account, et cetera. It drives real savings in premiums for the employees and beneficiaries of those accounts. So as we look at these issues, we need to peel back the rhetoric and look exactly what's going on, what the data tells us. And as we look at that data, we will see that PBMs are driving real value, driving real cost savings, and driving real solutions to address these